generally my patients want to try supplements before they want medication. And for me, I always believe in informed consent. My job isn't to tell you what to do. My job is to give you options, and then you decide what to do based on the options I think are reasonable. And so many of my patients go, and I don't really want to start with medicine. Let's start with supplements and see how far we get. And and if they don't work like we hope, medicine is always an option.
Welcome to Successful with ADHD. I'm Brooke Schnittman, and if you have ADHD and are feeling overwhelmed, chaotic, and negative self-beliefs, you're in the right place. The Successful with ADHD podcast shares my guests' journeys of overcoming challenges, offering their tips and strategies for success to empower you to take control of your life and thrive with ADHD. Let's get started.
Hi, Dr. Amen, and welcome to Successful with ADHD. So wonderful to have you here.
Thanks, Brooke. What
Absolutely.
a joy. Thank you for helping me spread the word.
Absolutely. And I know how you talk about how ADHD is being more commonly diagnosed and people are understanding it more. So it's even more prevalent to have you on today to share all the wealth of knowledge you have about brain health and SPECT scans. And I know you have so much of a history in researching ADHD and different disorders in the brain. I know you have ADHD yourself. I believe your wife has it, your ex-wife. So, and some of your children do too. That's what I read.
I
at
don't
least.
have it.
Oh, you don't have it.
I don't
Okay.
have it. I've just been blessed to be around a lot of people who do.
Okay.
And it's impacted my life in huge ways, which has given me great empathy, but also a great ability to help.
Absolutely. Okay. So to give you an official introduction, I just want to share some of the amazing things that you've done. I know you're on a mission to end mental illness by creating a revolution in brain health, and you're dedicated to providing the education, products, and services to accomplish this goal. You are the leading author of 12-time New York Times bestselling books. I happen to have two versions of one of my favorite books. One is from about 20 years ago when I was studying ADHD, and one is more recent. And I mean, huge accolades. I know I haven't even hit on many of them, but you have done more than 230,000 SPECT scans as well in 155 countries. So tell me a little bit about SPECT scans compared to just a typical DSM-5 diagnosis of a disorder.
So most psychiatrists make diagnoses based on symptom clusters with no biological data. That should cause some people to be suspicious. About 32 years ago, I started looking at the brain with a study called SPECT, which is a nuclear medicine study that looks at blood flow and activity. It looks at how the brain works. And what we found is it's very good at informing why you have the symptoms that you have. And giving everybody a stimulant is probably a bad idea because they help some people, often dramatically, and they hurt people, often dramatically. And so throwing darts in the dark or medicated tipped darts in the dark at people just makes no rational sense to me. And
Right.
when I first looked at the brain, I thought ADD or ADHD would be one thing, would show low activity in your frontal lobes, especially when you try to concentrate. And I quickly learned it's not one thing. It's 5 different things, and then 6, and now 7. different things in the brain. And when you know the type of ADD you have, you're just much more likely to get better. And you're less likely to make mistakes, because mistakes with patients are not innocuous. If you make somebody worse, they become demoralized, and then they don't want to get help. So having more information, in my experience, has been helpful to get people better faster.
Absolutely. And ADHD is complex. So would you say that anyone with a complex disorder should get a SPECT scan as a first line of defense before just being treated based on the symptoms medically?
Yes. I think if you don't look, you don't know, and we should stop lying about that.
Sure.
I mean, should anybody who has crushing chest pain have their heart looked at?
Of course.
Well, of course they should. And, anyone who has crushing depression or crushing anxiety, or they're failing in school, well, why wouldn't we evaluate the organ of behavior, which is your brain?
Right. That totally makes sense. And why do you think that psychiatrists don't often study SPECT scans or do SPECT scans?
Because it's not part of their training. It's not part of their tradition. And when you start looking at the brain, it completely upends how we practice psychiatry. The idea of giving people drugs based on symptom clusters with no biological data really becomes insanity. After you look at the brain, you realize there's a whole bunch of causes for ADD or for depression or for anxiety disorders, from traumatic brain injury to toxic exposure to the terrible food we're feeding people. The idea in psychiatry is anxiety, depression, ADHD, they're genetic disorders based on neurotransmitter abnormalities. We give you the drugs, balance your neurotransmitters, and you're fine. The problem is no psychiatric medication cures anything. And they change your brain to need them in order for you to feel normal. And I have a problem with that.
Totally.
Because I don't want to start something you might not be able to stop. And there's, if you go to the American Psychiatric Association's annual meeting, they have these huge booths, which means they're making a ton of money from the pharmaceutical industry. Well, that's not why I became a psychiatrist. I became a psychiatrist to help balance people's brains, their minds, and to help them be less reliant on drugs rather than more reliant. Now, I'm not opposed to using medicine, but it's just never the first
line of
and
defense.
the only thing I think about.
Yeah. So I don't know if you've changed your opinion since you've written Healing ADD, that stimulants are not addictive, they can be addictive, or does someone have to have an addictive personality to get addicted to anything?
So my experiences are not terribly addictive in the doses that I use. The big problem I have with teenagers is they don't want to take their medicine. Because if you go too high on the dose of a stimulant, it flattens them. They look tired. Isn't that interesting? Give someone a stimulant and all of a sudden their personality's just a bit flatter.
Yeah.
It's not like, whoa,
Right.
and they talk
give
too
them
much,
coffee,
they can't sleep,
same thing,
and all
yeah.
of those things. Now, if you give it to the wrong person, they do get that. But when you give it to the right person at the right dose, it tends to calm them down and tune them in, and they can be more helpful. But I remember Caitlin, my daughter, who had the hyperactive variety, when we first put her on a stimulant, it completely calmed her down. which was so helpful to me
To
because the
you.
whirlwind that she
Yes.
brought into my life was
Sure.
stressful. But then I'm like, okay, the dose is too high because she looked a bit stoned. And I'm like, okay, that's not the goal. So I'd really,
Bring it down.
decrease the dose to help her. It's very important. And, people go, oh, I don't want to give my child an addictive medicine. And I understand that. And people should always ask about the side effects. But
Hmm.
one question they should also ask is, what are the side effects of
Not
not
being on it.
treating someone who
Absolutely.
has ADD, from school failure, divorce, incarceration, bankruptcy,
Oh
job
my
failure?
gosh.
I mean, they're rampant.
Absolutely.
But let's not call it one thing, because it's clearly not one thing.
Yeah. Yeah. So and I would love to go back to the 7 types of ADHD in the next few minutes if we can. You talked about the effects of not treating your ADHD, not being on medication or having the right treatment overall. A lot of individuals who don't know they have ADHD or aren't managing their ADHD might do drugs or alcohol or marijuana. You talk a lot about what that does to the brain. Can you elaborate on that?
Well, once you start looking at the brain, you can't unsee it, from the impact of alcohol or drugs, marijuana, bad food, digital addictions, not sleeping. And when you have untreated ADD, you often feel awful or frustrated, or you're not at your potential. And
Hmm.
that's very hard on your self esteem. That should never, that you try, but it's not working like other people who try. So you use other substances to feel well, but they don't fix you. I mean, it's like a short-term fix
Hmm.
that's continuing to cause a long-term problem. And I always want to give things to people to help them feel better now and later versus now
Just
but
now.
not later.
Yeah, that makes sense. Okay. Can you share? You had said that with the brain specs, you've noticed that there were 5 types of ADHD, 6 types of ADHD, 7 types of ADHD. How do those differ from the classic 3 types of ADHD?
So we see classic ADHD, hyperactive, restless, impulsive, trouble concentrating, disorganized, late. We see inattentive ADD. They're not hyperactive and not really terribly impulsive, but they have focus problems and organizational problems and procrastination problems. Um, I'm not really a fan of the hyperactive, impulsive, but not inattentive. It's just extremely rare in my experience. Type 3 for us is what we call overfocused ADD,
Hmm.
where the problem is not that they can't pay attention, it's they can't shift their attention. So they end up stuck on certain thoughts or certain behaviors. Type 4 is temporal lobe ADD, mood instability, irritability, temper problems, dark thoughts, plus ADD. Type 5 is what we call limbic ADD. It sort of looks like a combination of mild depression
Hmm.
with ADD. It's sort of like the glass is always half empty.
Hmm.
And then the ring of fire ADD. So that was the 6th type I described because I just couldn't ignore it anymore on scans. It's like the brain works too hard, and it's sort of
Sure.
like ADHD plus a lot of sensory overload. And then anxious ADD. Tana, my wife, has that type where she's pretty on time because she's anxious, but also never met a cabinet door she wanted to close or a wrapper she actually wanted to throw away. So, um,
She doesn't believe in garbage's use.
yeah, so she has someone that helps her organize. And I think
Okay.
that's,
Great.
a great strategy. And I'm a huge fan of getting a coach to help you organize your life. That can be so helpful. And if you run a business, don't have an ADD assistant. If you do, you're just going to chronically be frustrated and unhappy. But knowing the type, stimulants like Ritalin or Adderall, Vyvanse, Concerta are really good for types 1 and 2.
Mhm.
But they make type 3 more obsessive. They make type 4 angry, sometimes even hallucinate. They make type 5 sad, and there's a lot of negative rebound with it. For type 6, 80% of the time, stimulants make them worse, sometimes angry, depressed, suicidal. And type 7, it makes them anxious. So
Gotcha.
let's just stop, saying this is one thing with one treatment. Sort of like that saying chest pain is one thing with one treatment. Most thoughtful people would go, that's ridiculous. And when you know your type, you're just more likely to get the right help, either from medicine or from natural supplements. So if we think of natural supplements, tyrosine, which boosts the amino acid, it's the amino acid building block for dopamine, could help type 1, type 2. Tyrosine plus 5-HTP could help type 3. 5-HTP boosts serotonin. Tyrosine plus GABA could help type 4. Tyrosine plus saffron could help type 5. Targeting the medicine or supplements to your type just helps you be more effective.
So would you suggest typically that your patients get on supplements to treat their ADHD before medication?
Generally my patients want to try supplements before they want medication. And for me, I always believe in informed consent. My job isn't to tell you what to do. My job is to give you options, and then you decide what to do based on the options I think are reasonable. And so many of my patients go, and I don't really want to start with medicine. Let's start with supplements and see how far we get. And if they don't work like we hope, medicine is always an option.
Absolutely. And I know that you have the ADDtypetest.com where you can see without the SPECT scan, if you can't afford it or you can't get one, it's, an example of what type of ADD you have based on the 7 types that you've discovered. And then it talks about the different types of treatments that you can take. So I actually did one the other night, and I saw the supplements that you recommended. So there was GABA and everything that you were talking about, saffron. And it was very interesting. My husband did it too. He had 5 out of 7. I had 3 out of 7. I would love to talk to you also, like, how does someone have 5 out of 7 types of ADD?
Well, it's not uncommon so if you have type 1, classic, well, it automatically means you're not type 2 because, type 1 is hyperactive, restless, impulsive, can't concentrate. 2 is just you can't concentrate. So, but very common to have 1 and 3 together. Those are my children and grandchildren of alcoholics. And if you had a concussion, so my sense is your husband probably had a concussion at some point. Well, that's very common in type 4.
He was a soccer player.
He was a soccer player?
Yes.
Yeah. So he had a concussion. Or at least he had hundreds of subconcussive blows. And then, if you get a bit sad, that gives you 5. And if you're a bit anxious, that gives you 7. So it's very common. ADD, anxiety, and depression run together a lot. So of the 3, which did you have?
I had anxious, overfocused, and temporal lobe. And I have an anxiety disorder. I have a generalized anxiety disorder. And I was diagnosed with combined ADHD.
So now that you know it, I always say treat the temporal lobe issue first, because that tends to allow us to do a better job at treating the over-focused issue or the focus issues.
Yes. And I know you talk about this also in your book, and I'm sure a lot of people ask you this. Can you differentiate between overfocused ADHD and OCD? So I know there's a lot of traits of obsessive thinking and overfocused ADD.
Yeah, so the difference would be, do you have ADHD by history over time? So people have OCD, that they often don't have any of the ADHD traits: short attention span, distractibility, impulse control problems, disorganization. In fact, they're usually hyperorganized. It's when you have both and the ADD stuff happen over time. You can really look back into your childhood and go, took me longer to do my homework than it took most people. My handwriting wasn't that awesome, and teacher said I talked too much in class, or a half an hour of homework would take you an hour to do. Those would be some of the things that I would look for.
Okay. And you also say that there's different causations of ADHD, but typically speaking, if there's a child with ADHD, there's at least a parent with ADHD.
Typically. Yeah.
Typically.
I mean, it's so heritable that if the child has it and I can't find it at all in mom's history or mom's side or dad's history or dad's side, I look at the child to see if they look like the parents, to think maybe they were switched at birth. I mean, it's just that
might happen more than we
heritable.
think.
But, you know, what we're finding, digital addictions double the risk of having ADHD. Brand new study out. Kids who spend more than 2 hours a day on their devices have a significantly higher risk. So I think device addiction, digital addictions are increasing the risk. I think the toxic food, the ultra-processed foods we're giving kids who have a fast food diet have a higher risk of ADHD, toxic products, all the plastics and BPAs, pesticides are increasing the risk. Mercury, lead, arsenic, mold, all increase the risk of ADHD. Plus, there's this fascinating study from Holland where they took 300 children with ADHD and put them on an elimination diet. They basically took all the crap out of their diet. They could eat lamb, turkey, vegetables, fruit, pear juice, rice. That was it. 3 months later, 70% of the kids lost their ADHD symptoms. So is it possible that this epidemic of ADHD is in large part driven by the toxic food we are giving to ourselves and our children?
So were those children then given a SPECT scan or any brain imaging to see if they were okay?
They weren't.
They just
It
lost
would
some
have
of the
been
symptoms.
fascinating. Be a great study for us to do. But, you know, I've done enough SPECT scans to know that if you're being poisoned, food, environmental toxins, your brain is not going to work right.
Sure. It's interesting. Before I knew I had ADHD, I did an elimination diet, and the gut-brain connection, my IBS went away. I was clear-headed, focused. It was very hard and difficult to stay on that elimination diet, but I did realize that gluten and dairy for me were the two that were triggering my brain fog and my IBS.
So you only want to love food that loves you back. That you're in a relationship with food. See, you want to make it harder to cheat than to do the right things. I mean, it's just so important I think a lot of the increase in ADD in our society is directly related to demonizing fat in our society. So, funny story. 1972, I turned 18, and my dad told me if I voted for McGovern, the country would go to hell. And I
Did you
voted
vote
for
for
McGovern,
McGovern?
and the country. I
Perfect.
voted for McGovern, and the country went to hell, but it had nothing to do with McGovern. But he becomes a very important player in the demonization of fat. And the sugar industry paid two scientists $50,000 to write articles that sugar was innocuous and fat was the problem. Well, it's a lie. And we've learned this because as they took fat out of our diet, we became sicker and fatter than ever before. 60% of the solid weight of your brain is fat. And by
Amazing.
taking fat out of the diets of all these children, we created more brain problems for them. And, I often say if someone calls you a fathead, say thank you. But children should have plenty of healthy fat in their diet.
Absolutely. Absolutely. And I know omega-3 fatty acids are huge for individuals with ADHD.
And found to be helpful in studies. I mean, it's generally not going to fix you, but it's one of those things. I just think all of my patients should take omega-3 fatty acids, either with fish oil or we have a new vegan omega-3 for people who are sensitive to fish or want to be vegan.
Wonderful. So you say that video games and screen time for more than 2 hours a day could possibly cause ADHD, if I heard you correctly, or the ADHD symptoms.
Well, I wouldn't give them 2 hours a day. That was just the research I read recently. Uh,
Gotcha.
I wouldn't give more than a half an hour a day, and I would delay it as long as you could because, there's just not big benefits for being on gadgets. It's
Yeah, I
just
know you
not.
mentioned the black lines are similar to ADHD, um, and how it appears in the brain when you're watching TV or you're doing video games. Can you elaborate on that?
Well, when you play video games, it dumps dopamine. I mean, if we just think of ADHD, at least types 1 and 2 is a dopamine deficit disorder. We're thrilling kids to death by giving them things that constantly dump dopamine. You want to
Right.
store dopamine up so you can concentrate. But if you give them caffeine in the morning, if you give them Red Bull, if you allow them to vape, if you let them play video games, if you give them unfettered access to smartphones, what you're always doing is you're dumping dopamine. And so they don't have dopamine stores to get their homework done. And they're
Gotcha.
become thrill seeking or conflict seeking or love seeking as a way to boost their dopamine. And then, because we don't have good control over digital access, I have 8, 9, 10-year-old boys addicted to pornography
Mm,
because, you can't give a developing mind this stuff without it having a very negative impact on the pleasure centers in their brain.
absolutely. I completely agree. And our youngest, he loves Fortnite, loves it. And he's been spending way too much time on it. And the result is anger, outbursts, crying, like a very extreme emotions once he comes off of the video games. So we're definitely lessening that at this point. He has hyperactive ADHD too. So he is getting that stimulation of dopamine from the video games.
How old is he?
He is 9.
Yeah, boy, severely limited. And otherwise, these companies, and I don't mean to be a conspiracy theorist,
No,
but I am.
they have psychologists looking at it, right, to
I,
make it
I,
more
I am.
addicting.
They create these gadgets to steal mind share. And they do it by reinforcing techniques that boost dopamine. And in Silicon Valley, many of the engineers there won't give their kids gadgets because they know how damaging they are. And you don't want to wear out your pleasure center when you're young, because just think of what that will set you up for. And I end up having to send some kids to detox programs. And I noticed when my grandson was a year old, he was good on a smartphone. And we thought he was really smart until we realized it also increases tics.
Oh,
And so supervising that has become incredibly important. You just don't want to give them stuff that steals their
absolutely.
mind. And they don't have the same love for your child that you have. They have love for money.
Money.
And
Right.
so they want as much of their attention as possible so they can sell them stuff.
I mean, it's a $1 billion company, right? My kids get money and it goes straight to Fortnite. Hundreds of dollars. You're right. So,
Yeah.
what do you suggest though for individuals with ADHD or autism or anyone who has, social issues, let's say, just for lack of a better term, and they feel that when they play video games, they can socialize with other people for the first time?
Yeah, but it's a lie. It's not the truth. They're socializing with a digital image of that other person. They're not actually having a real relationship.
Yeah.
And, it's portraying a real relationship, but it's not. And so I would find ways to get them appropriately treated so when they're with other kids, they can enjoy each other. And I
Hmm.
think social skills training is not used enough to help these kids.
Sure.
I always ask kids, so what do you want? What's the goal? And is your behavior getting you what you want? Just as a way to activate their frontal lobes. And 9-year-olds are not too young. What do you
Yeah.
want? Your behavior getting it. But if I'm allowing them to dump dopamine through the day, what they want is their drug. And they'll do everything to get their drug, including becoming violent with their parents.
It's sad. Yeah. Oh, so we have the 7 types of ADHD. You had talked about a lot of the different causes. You mentioned the digital piece. Most of us are on a computer or phone as adults more than 2 hours a day, especially working from home. What does that do then for ADHD or people who are adults who don't have ADHD, but then are on screens for longer than 2 hours a day?
I think there's a difference between you and I being on Zoom or whatever we're on and interacting, focused on the conversation versus killing hundreds of ants or bad guys coming at you.
Mm-hmm.
That, as much as I like talking to you, it's not the same thrill as murdering all
But why
these
not?
things. Right. And so I think, whether it's me writing on a computer or doing interviews or seeing patients, I'm not dumping dopamine. I'm sort of dripping it, especially if I'm doing things I really like this interview. So I would say, technology is just part of it. But if I was constantly checking my phone, if I was constantly waiting for that next ding, to happen or the buzz in your pocket, then yeah, that's sort of wearing out your pleasure centers.
Yeah.
So
Yeah.
having digital discipline it's just absolutely essential. We are, I don't know if you know, but we're in this mental mess where 57% of teenage girls feel persistently sad. That
When I
30%
was,
have.
oh gosh. Yeah, I saw that in a recent article you wrote. And when I worked in the middle school as a special education director, more females were coming in with anxiety and depression than ever before. Suicidal ideations, suicidal attempts.
I have a new book coming out next year called Raising Mentally Strong Kids, and I have a public television special with it. And I've just been thinking a lot about why. What's causing this dramatic rise? I'm way older than you are, but my guess is when you were in
I
middle
just look
school,
good for my age, I guess.
well, when you were in middle school or you were in high school, there were issues, but they weren't at this level.
No.
And so why? And so one is the pandemic and our reaction to it. When you isolate people and then you give them death tolls and fear, that's a problem. That's going to create big problems. COVID, all by itself, it creates an inflammatory bomb in the brain.
Oh, yes.
Being forced to be vaccinated, people don't like that. People don't like being forced, and vaccinating kids is a bit insane. And then the digital addiction, and the parents are having more problems than ever before, and children are like violins and they play the stress of their parents. And then this crazy relationship we have with alcohol and drugs, where we think of alcohol as a health food and marijuana as innocuous, both two huge lies. And then if you add toxic products, toxic food, toxic thoughts, and then two parent working families where there's just a whole bunch of guilt about not spending enough time with the kids. And so you overdo for them,
Right.
which creates kids who don't like themselves because they don't feel competent, right? I mean, how you develop self-esteem in someone is you help them be competent. It's like they have chores and you're not doing everything for them, and you don't fight their battles. You teach them to fight
How to fight
their
it.
battles. I think those are the way out, that each of those have an answer and a way out. Like, we really think about what we feed them. And it's like, oh, my child won't have anything for breakfast except Captain Crunch or Frosted Flakes or donuts or
Yeah,
pastry.
that
And it's
that is a
like,
dilemma with ADHD because of the sensory issues sometimes. My
yeah, but they're not going to
9-year-olds.
starve. If
No,
it's like, okay, we're going to
100%.
find things you like that like you back. And quite frankly, I'm not buying anything in this house that doesn't
That's
serve
processed.
your health. So, I take them to the store and go, we're going on a treasure hunt. We're going to find 10 things you love that love you back. So I have one of my favorite patients of all time has Tourette's, and I diagnosed him, I think, when he was 9, and I love this kid. So the first thing I did was put him on magnesium
Mm-hmm.
and an elimination diet. So magnesium to decrease the muscle tics, an elimination diet, because I've just found it to be so helpful. Eliminated gluten, dairy, corn, soy, artificial dyes, and sweeteners. And he came back 2 weeks later, and the tics were 95% better. But he looked sad. And I'm like, buddy, what's going on? He said, Dr. Amen, I don't like any of the foods. I'm like, you don't like any of them? He's like, nope. And so my next appointment with him, we actually went shopping.
Oh, that's so
And
sweet.
I'm like, so your job is to find 10 things you love that love you back. Well, on that one shopping trip, we found 23 things he loved
Come on.
that loved him back. And now we're up to 157. And there's no argument about food. There's no depression about food because he realizes that the tics brought him a lot of problems with being teased and standing out in a negative way. And it's just, you gotta eat food you love that loves you back.
And that is essentially who you are as a doctor. I mean, you study the inside of a person's brain and then you treat them based off of what you see on their inside. And it seems like that's the same for the elimination diet. So, try to eliminate all of the things that typically make you swell. And then you slowly bring back those food and figure out what's impacting your body.
Yeah, and I didn't have any nutrition education during my psychiatric residency, not one lecture. But, I feel like I'm a really good doctor because I listen. And when I had the mother of an autistic child tell me that when she eliminated gluten and dairy, he got 50 new words the next week, I'm like, oh, I have to pay attention to that.
Wow.
Or when I had a patient who had arthritis, stop aspartame. Well, I had arthritis at the time, and I was drinking like 32 ounces of Diet Pepsi a day. And I'm like, well, let me stop aspartame. And my arthritis went away. That I just, it's mostly through paying attention that diet matters.
Sure.
Environmental toxins, they matter.
Sure. Do you think that trauma has anything to do with ADHD?
I think if you have trauma in your family, and if you experience trauma growing up, you're going to have more likely to have the over-focused ADD type or the anxious ADD type. I'm actually doing a study now on adverse childhood experiences. So how much on a scale of 0 to 10, how awful was your childhood? And like my wife's an 8, and we adopted both of our nieces because their parents were drug addicts. They're both 9s. And that has a negative impact on brain function and focus for sure. And if your parents hate each other, it's really hard for you to focus in school. If your home is unpredictable, if you're being molested, it's really hard to focus in school. So absolutely, I think trauma plays a role. It's one of the reasons I think it's really important to assess trauma when you're assessing anybody with a brain or mental health issue.
So for instance, I had trauma growing up. I was bullied pretty much my whole life. My parents were divorced, didn't like each other at a certain time. No one in my family is diagnosed with ADHD except for me. So are you saying that it can mimic ADHD symptoms or actually cause ADHD?
I think it would be more mimicking ADHD, because if I help you eliminate the trauma or help you work through the trauma, odds are you're going to be able to focus much better. But
totally,
how would we know, Brooke, unless we actually looked at your brain? Do you have the classic ADHD pattern that responds to stimulants, or do you have the trauma pattern that would respond better to something like EMDR, a specific psychological treatment for trauma? Some people put you on psilocybin and have you do therapeutic mushroom trips. It's not my thing.
Can you tell me more what you think about that? Yeah.
Yeah,
I'm glad
I
you
just
brought that
haven't
up.
seen it fix anybody. I've seen a lot of people say that they were better and they got insights and they had more compassion, but I've not had anybody. They did, a course of 6 sessions and then they're fine. the sort of big aha for me was I was a consultant on the movie Concussion with Will
Oh,
Smith
wow.
about traumatic brain injury in football.
Who has
And I
ADHD? You
love Will
treated him, right?
Smith.
Mm-hmm.
And I read his book right before the Oscars last year. And at the end of his book, he talked about having ayahuasca 14 times. So
Wow.
ayahuasca, a hallucinogen in South America. And then he attacks Chris Rock on national television. So
So
I'm
you think
thinking
it had to do with the ayahuasca?
I'm thinking it absolutely didn't fix him.
Yeah,
It,
that's true.
it
Fair enough.
didn't fix anything.
Listen, I mean, I love the whole cold exposure thing. I think that's wonderful for dopamine, for sure. And it's so sad that untreated ADHD, like Will Smith, can lead to that impulsivity of slapping someone on national television and then being banned from the Oscars forever.
But if we don't look at his brain, it's easy to call him bad. It's way harder to go why. It's like,
Yeah,
why did that happen? And, the fallout for Chris Rock, I mean, he experienced emotional trauma, physical trauma
absolutely.
on national
Absolutely.
television. And so I would love both of their scans,
Oh
one to
my gosh.
explain, so why did he do that? So likely had frontal lobe problems that night, on a night that should have been celebratory for him. I mean, he won the Oscar. I thought he should have got the Oscar for Concussion, but I'm biased. I mean, he won the Oscar,
Creating concussions
but
for other people.
couldn't stay in the appropriateness of the moment, which is very unlike him.
It's interesting, and I'm glad that you went there because so many of us with ADHD hold it all together for so long, especially in school. And then we come home and we explode, right? We explode on our parents, we explode on our loved ones. And Will Smith, he was always the guy that wouldn't use curse words. He was politically correct, nice from the outside appearance. What do you think about that? Do you think it was him holding on to his impulsivity and then he got triggered because of his wife and then it all came out? I mean, I know you haven't seen, we have to see his brain to understand, but do you think there's any relationship to that and the child in the classroom?
Well, I think if you just look at how stress is stacked, so odds are he, in his autobiography, he talks about growing up in a traumatic environment with an aggressive dad. He also talks about head injuries that he had, and fame wears out the pleasure centers in your brain. And now we have these 14 ayahuasca trips. We have a marriage that's in trouble. I mean, they talk about publicly,
Right.
about how she had an affair
Jada had an
with
affair.
her
Right.
son's friend. And I mean, it's publicly humiliating. And if it's maybe not one of those things would have caused the reaction, but the stacking of all of those things caused the reaction.
Right.
And so getting somebody well, you sort of have to address all of those things. And, I'm always interested in how all of these brains from Jada and Chris Rock will interact to create joy or holy terror.
You mentioned EMDR for ADHD, and I know you talk about ants. So reframing negative thoughts and projection that we think we might feel someone's thinking about us, being mind readers, all that. But EMDR, can you tell us a little bit about how that changes the brain?
So when you have trauma, emotional trauma, it fires up your emotional brain to look for trouble because it protects you. If you can head it off, it protects you. EMDR helps to reset it. It helps to calm that area of the brain. You still look for trouble when necessary, but you don't have to look for a white tiger around every corner in your house or at work. I'm
Gotcha.
a huge fan of EMDR.
Oh, yes. Yes. A lot of my clients love it. My coaches, I had one EMDR session and it blocked out some traumatic memories in my dreams. I know your time is running up, so I want to be respectful of that. So I really appreciate you being here and sharing your wealth of knowledge about brain health and ADHD. I know you've impacted millions of lives, and hopefully this interview impacts millions of more. Can you just share with everyone where they can find you, maybe take a free ADD type test, get supplements, learn more about you?
Certainly. They can find me at amenclinics.com, amen like the last word in a prayer, clinics.com. They can take our free ADD type test at addtypetest.com, or our brain health assessment at brainhealthassessment.com. They can follow me on Instagram at doc_amen. That's on Instagram, or Doc Amen on TikTok. And we'd just love to be helpful. I have a brand new book out called Change Your Brain Every Day, really written for the ADD person. 366 short essays, one a day, 3 to 5 minutes, something simple to do. It's snackable content, so you can have a better brain and a better life.
Thank you so much. And all of your books are like that. Even this, you have a manual of how to get through it for the ADHD brain. So thank you for being such a huge impact on our community and for being on today.
Thanks for listening to this episode of Successful with ADHD. I hope it helps you on your journey. And if you need any additional support for you or a loved one with ADHD, feel free to reach out to us at coachingwithbrooke.com and all social media platforms at Coaching with Brooke. And remember, it's Brooke with an E. Thanks again for listening. See you next time.